Michigan, Mr. Hoekstra, who has been just a very great spokesman about these issues. Mr. Hoekstra, I yield.
I thank my colleague for yielding, and I think you made a great point. It's not about the quality and the quantity of health care. It's about control. And that's why you see such a difference between the Republican proposal and the Democrat proposal. Because the Democrat proposal says we're going to totally wipe out, over a period of time, private sector health insurance, and we're going to take the freedom that the American people have to direct their insurance, to direct their health care, and we're going to move it over and we're going to put that responsibility, that authority, and that control in the federal government. And you know what that means? That means that's why this is their bill, but that's not all of it. That's why that's their bill. That's why this is their bill. And this is almost all of it. Don't have the last 40 pages that the Speaker added to the bill last night. But when you're going to take over health care and move responsibility from you and me and our constituents and move it to government, it takes you 2,000 pages to describe what you're going to do, create the 3,000 times where it says the commissioner shall, will, or must, because those are new decisions that the federal government's going to make and we're not going to make. If you want to fix health care and address the problems, this is all you really need. That's the Republican proposal.
That's the Republican bill.
And the Republican proposal says we want to do tort reform. We want to deal with pre-existing conditions. We want to do some stuff with competition and those types of things. This fixes health care, takes steps towards improving and fixing the problems that we've identified. This creates massive government bureaucracies. This represents a loss of freedom. And this says we're going to fix the problems that are out there.
Reclaiming my time, I want to bring up a point that just to approach something that you brought up that's very, I think the American people need to understand, Mr. Speaker, in that humongous bill that Mr. Hoekstra has his hands on right there, the Pelosi health insurance bill. In that bill, it says that by 2013, no one can sell private insurance to individuals or businesses. So we heard from the President that if you have health insurance and you like it, you can keep it. That's a bald-faced lie, because the bill itself says that after 2013, no one can sell private insurance to individuals or small businesses.
They've got to be approved by this new bureaucracy, the czar.
That's right.
So what we get is this is 2,000 pages, but it's still an outline. It creates, this outline creates that which is going to make all of the decisions. And when you take a look at all the bureaucracy and paperwork that's going to come out of here, this is only the beginning. This is not the end. This is the beginning of government-run health care in America. We did a telephone town hall tonight. So we had about 1,000, 1,200 people on the phone. And people were asking, when's this bill going to come up? And you say, well, right now the plan is to have it come up on Saturday. And then they say, well, why? I mean, the Senate's has now said that they're not going to vote on this bill, or they're not going to vote on health care reform until when? I think the majority leader has said in the Senate they're not going to do this until after the first of the year. And so we've got 1,990 pages plus 40. We're supposed to not only read this but understand it in about 7 days, and we're not going to have any opportunity to go back to our constituents and say, what do you think of this? Or explain it to them and explain the difference between the two bills, the difference in approaches, government takeover of health care, freedom for you and more opportunity for you to select your health care. And these folks, they're outraged, saying, why don't you take an extra week? Why don't you take an extra 2 weeks? We're supposed to be home next week for Veterans Day. Why not schedule a whole series of town hall meetings? And I think that, we saw some of this take place and saw some of the impact of this yesterday. all right, where people around the country send a clear message to the White House and to the leadership of this Congress saying, we don't like the arrogance with which Washington is treating our concerns and our issues. That, this stuff, we're not going to have an opportunity to provide an insight or a perspective on these bills to our representatives in Congress. And, they're just going to ram this through. And the end result is they sent a clear message. They sent it across the country. They sent that message in Virginia. They sent it in New Jersey. They sent that message in Michigan. All across the country saying, if this is the change that we were looking at, if this is the change that came as a result of the elections last year, we sure don't like it. And there's an arrogance with saying, we're going to force this down Congress. We're going to force this on the American people without providing them with the opportunity to provide feedback. This is why, my colleague and all of us are excited about this process, saying if we can't take this bill to the American people are going to come to Washington tomorrow. As we were meeting last night, we in the member's office, we got a call, and it was two people from Oregon saying, we're coming. We'll be there on Thursday. So late Tuesday night, they were wondering what they could do to have an impact. They said, we're coming from Oregon to be there on Thursday. I think another one of our colleagues reported tonight, because we really don't know how many people are going to show up tomorrow. But he, I think yesterday, said there's 10 buses coming from New Jersey. Tonight he said,
I didn't hear the number.
You didn't hear the 24 buses coming from his congressional district in New Jersey tomorrow to be here today with us. And, we don't know exactly what's going to happen, but it's a clear indication that in 4 or 5 short days, we have touched people around the country who want to come to this press conference, or some quote-unquote may call it something else.
Christie going to drive
rally
that bus?
or whatever, but what's that? It's a press conference, and we've touched people from around the country who are saying, finally, they came here in August, they came for the Tea Party and all of those types of things. Another opportunity to express our opinion, and hopefully by coming to the Capitol, meeting with our representatives, they'll finally get the message, we want freedom, we don't want government health care.
In fact, I carry a copy of the Constitution in my pocket all the time. I believe in this document the way our founding fathers did.
The gentleman yield?
And
I don't think that's the Constitution. That can't be the Constitution.
I
mean, if that's the framework, if it takes 1,990 pages to do health care, it ought to take at least 20,000 pages to be the Constitution. How many pages in the Constitution?
Well, this is not only the full text of the Constitution, but is every single amendment that's ever been made to the Constitution, plus it has the entire text of the Declaration of Independence in this little book.
How many pages? When you're talking about freedom, it doesn't take a lot of pages, does it?
It doesn't take very many.
I thank my colleague, and I thank him for sharing his copy of the Constitution, and we made the point that the Constitution establishing this nation and the amendments to the Constitution is 44 pages. This is 1,990 pages. But I think more powerful is what this document says, is when you are protecting freedom, it doesn't take a lot of words. And when you're limiting government, it doesn't take a lot of words. It says, and think about the difference. This document, the Pelosi health care document, I think over 3,000 times, it says the commissioner shall, the commissioner will, the commissioner may. That's all losing authority. And if you take a look at the Constitution and you read what the Constitution says, the Constitution puts limits on what government will do and protects individual rights. Here it says, the Congress shall make no law, a limitation on us, not on the people. This expands government. Shall not be infringed. No soldier shall, without the consent. The right of the people to be secure against unreasonable searches. No person shall, nor shall private property be taken. The accused shall enjoy. This document, it protects the American people from invasive and over-intrusive government. That's what the Founding Fathers thought. They would be horrified by this bill to see that, the commissioner shall develop the health care plans that you and I will have the opportunity to choose from. The commissioner shall establish penalties for those people who don't buy insurance. The commissioner shall develop this. The ombudsman shall do this. There's no limitations on government in here. This is all about expansion of government. And our founding fathers were all about limiting government. This is night and day. This is 44 pages guaranteeing our freedoms. This is 1,990 pages taking freedoms away. As many have called and said, you know, Congressman, is this actually constitutional? Maybe they'll find a court that says this is constitutional. But in the spirit of the founding fathers, they would have been horrified by what this document does and how it limits individual American freedoms. You know, we'll have to take a look and see if we can't, you know, although I think the people that will be at our House call tomorrow, they understand this document and they understand the night and day difference between this document and what Speaker Pelosi is trying to do here with this document. That this shreds the Constitution, it shreds personal freedom and gives power to Washington and bureaucracies. In one vote, 18% of the economy, that amount of freedom moves from our constituents and it moves to Washington, D.C., and it goes flying right through this House, and it goes right into unelected and unaccountable bureaucrats. I yield back.
I'll reclaim my time. In fact, those unelected bureaucrats are going to stand right between every patient in this country and their doctor.
This is the document that the Republicans have proposed to fix health care, the parts of health care that have been identified as being broken, 232 pages.
Now, I'll reclaim my time. Let's make it clear, that is the Republican alternative that the Democrats keep saying we don't have.
Right. And then this is the Speaker Pelosi's, most of her bill. It's 1,990 pages that was introduced last week. It doesn't have the 40 pages of the manager's amendment, which were added to the bill late last night. This is the document that contains in it the phrase, the commissioner or the government shall, something like 3,000 times. The Constitution is all about freedom. This is all about the loss of freedom.